Did you know that nearly 1 in 3 adult children notice a decline in their parents' health within just one visit after being away for 6 months or more? If you're visiting your parents for the holidays and something feels different, I made this video just for you because we're right around the holidays. The holidays, I know, are often the first time in months, sometimes longer, that adult children truly spend extended time with their aging parents. I mean, you walk into the house you grew up in, your room is still the same, but really suddenly you notice things what you didn't expect in the home. Maybe the house isn't as tidy. Maybe mom repeats the same story 3 times. Maybe dad seems unsteady getting up from the couch. And the question quietly creeps in during the holidays that you don't want to talk about. Do my parents need help in home? So today we're going to talk about what to observe in the home and with your parents, how to approach the conversation when parents are resistant, and they will be, and how to research and choose the right home care agency without guilt, pressure, or panic. And this takes time, right? I have another video about how it takes a marathon to convince parents. So when adult children like you visiting aged parents, the home often tells a story, before even your parents do. Here are some key signs to look for in the home. Number one, housekeeping and organization. If there's dust, clutter, or spoiled food in the fridge, unopened mail piling up, laundry undone or stacked for weeks, these can all be signals and signs of physical fatigue, mobility issues, or early cognitive decline. Number two in the home, notices safety hazards. Looking for loose rugs, poor lighting, stairs without railings, medications are scattered or mixed together or overdue or haven't been filled. Falls are one of the leading causes of hospitalizations among seniors. So this can happen at home. So safety is very important for you to observe. Number three, nutrition and meals. If you notice the fridge is empty, there's expired food, the reliance on snacks instead of meals, a lot of weight loss or dehydration, they're not drinking water. Difficulty cooking is one of the reasons why many families, frankly, explore in-home caregiving, right? So that they can help with the meals. So what to observe with your parents? Sometimes the changes are subtle, but they're meaningful. So physical changes. Number one, difficulty standing up or walking. They're shuffling, they're frequently sitting, they're wearing the same clothes over and over again. Cognitive and emotional changes is another thing to look for. They're starting to forget appointments or conversations they had. They have mood swings, they're withdrawal, they have confusions about dates, finances, or medications. Those are all different things to consider and notice. Also ask yourself, are they struggling with bathing, dressing, or grooming? Do they look a little, frankly, disheveled? Are medications being taken correctly? These are all known as activities of daily living or ADLs, and they are a core reason families turn to professional home care services, frankly, to help with these things. So now that you've noticed certain things, the big thing is, how do I talk to my parents? They're reluctant. And I'll be honest, this is the hardest part. Most parents don't say, I need help. They're not going to volunteer. They will say, I'm fine. I don't want a stranger in my house. I don't want to be a burden. Understandable. Now, at a very high level, here's how to approach the conversation with some dignity and respect for yourself as well as your parents. Lead with concern, number one, not control. So instead of saying something like, you need help, being very direct, try, I notice you seem tired lately. I want to make sure you're safe, mom. Number two, frame home care as support, not loss of independence. That's the biggest thing for a lot of seniors. Home care is not about taking control away from them. It's about helping your parents stay home longer, safely, and more comfortably. So instead of say, this is really to help you stay in your home, not leave it. So frame it that way. Number three, start small. So just suggest a few hours a week, maybe something with helping with errands or housekeeping or companionship or meal prep. Once your parents experience good caregiving, resistance often fades because they'll see that it's really helping them. So don't start big, start small. And the last thing is I want to talk about is, as I mentioned, is researching the best home care agency. Not all home care agencies are the same, and choosing the right one matters. So here's how I would suggest adult children evaluate professional home care providers. The first thing is making sure that they have licensing and insurance. Are they licensed in the state? Are they willing to give you that license? Are the caregivers bonded and insured and not contractors? They're actually employees. This protects your parents and your family because you don't want to be liable for anything that's happened in the home. Also ask yourself in terms of caregivers, are the caregivers background checked? Are they trained in dementia care, fall prevention, or personal care? What kind of training do they have? How do you onboard people? Number three, does the agency offer personalized care plans? A good home care agency should assess your parents' needs, customize one care, and not fit it all in one solution, right? They're not just looking for hours and shifts. They're actually trying to understand your care needs. Next is looking for an agency that communicates. Do they provide updates? How do they provide updates? How do you reach them after hours? Do they treat you as a partner in terms of developing the care for your parents? Lastly, review, of course, Google reviews, ask local community, ask your doctor, social workers, see how long they've been in the community. All of that matters. The best home care agencies, from my experience, earn trust, not just business. Now, moving on from that, I know many adult children, if you're watching this, may feel guilt for thinking about home care. But really, here's the truth. You're not replacing love. You're not replacing your love. You're adding support. Home care allows adult children to be daughters and sons again. Focus on quality time when you're visiting. Reduce burnout and stress. And for parents, the right caregiver and the right agency often becomes a companion, a safety net, a trusted presence when they're alone, so they don't have anxiety or they're worried about something. Okay, so in closing, if you're visiting your parents this holiday season, notice changes. Don't ignore that feeling. Just pay attention, ask questions in the right way, and just really have that conversation. Because the earlier you explore in-home caregiving options, the more control, choice, and peace of mind your family will have. And remember, needing help in the home is not a failure. It's part of aging, and it's okay to get support. So if this video helped you during this holiday season, share it with someone who may be facing the same situation. You're not alone, and neither are your parents, quite frankly. Happy holidays and Happy New Year.